Good evening. Here with the Pulse tonight. Thanks for staying with us. As vaccine access and registration has been open to more and more age groups, social media posts have been full of pictures posting their shots, rubbing their arms. There's still some vaccine hesitancy. Joined now by Dr. Mvuyisi Mzukwa, Vice-Chair of the SA Medical Association. Dr. Mzukwa, good evening to you. It's difficult to assess how many people might be vaccine hesitant, might be a little bit worried about receiving a vaccine. Are you finding that this is becoming a problem?
Yes, Steve, it's becoming a problem, and I think we've got lots of work to do, both from the National Department of Health and also, assisted by the healthcare workers. But I think most of the hesitancy that I've seen is from the government side, what I call a government hesitancy, because there've been hesitancy in terms of addressing convenience. People want convenience. In terms of the place, time, in terms of weekends and all those things. I mean, when you get people who are rolling out a vaccine program, expecting people to go to hospitals, some people don't want to go to hospitals. They are avoiding hospitals at this point in time. But the other thing is, this issue of delaying these drive-thrus, for convenience, and also taking the vaccine to the people in the rural areas. You expect a lady who doesn't have transport to go for more than 50 kilometers to get a vaccine. I mean, you call that hesitancy. It's the issue of access and convenience. So those are some of the factors that need to be taken into consideration.
So what you're suggesting is that government could encourage people to get vaccinated simply by making it easier.
Exactly. I mean, if you look at it, Steve, pensioners, it's only now that you've seen people arranging, in a way that is convenient for pensioners to be able to access vaccines. But also, like I said earlier on, if you have somebody who cannot, for example, who doesn't have transport, how do you expect that person to access vaccines? Issues of weekends, for example. You remember that in most cases there was no allocation on weekends, and that was an inconvenience for workers. I mean, for those people who develop side effects, is there a paid leave, a sick leave, for example, for them not to miss work? So those are the issues that needs to be taken into seriously. So.
One of the things that really helps for people who are worried about something is to go and ask a doctor. If you're lucky enough to have a general practitioner, a doctor that you know, a doctor that you've been to, the doctor's going to give you medical advice you're used to as a patient, accepting the advice of a doctor and following it. You swallow the pills that the doctor gives you. Presumably, when it comes to encouraging people to get vaccines, that'll be a big factor. People, if they can, will ask their doctor.
Yeah, the other things, yes, you're quite right. People, they want to talk to people that they are familiar with. There was an obvious failure on the side of government to include, especially general practitioners, in this rollout program. They have been very hesitant, and to an extent that we had to push, for those who are willing to do vaccinations too. Otherwise, government was very hesitant. And you get questions, as a general practitioner from your patients, Doc, are we coming to you for vaccination? And the answer is no, government wants to do it on their own. So those are the issues that, people, you can't just jump in and want to give vaccines to people who don't know, whom you don't know. So you want people, who are going to give you information, but also reassure you. And if you have a problem, like you develop side effects, you need to go to that person and talk the language that is understood by both the patient and the practitioner. But also, Steve, on that fact as well, the issue of language. When we talk about side effects and all these things, we speak, medical jargon and all those things, and not speaking also the language that is being understood by the patient. For example, when you talk about side effects, you need to make it simple. Use a simple language. For example, if I explain to my patients about side effects, I make an example of beans. When you eat beans, you eating that to fill up your tummy, but also for nutrition. But it causes heartburn. You develop gas in your stomach. Those are side effects. We need to be simple when we explain these things. Not some experts explaining side effects in a broad platform where other people cannot access.
Doctor, your members of the SA Medical Association were among the first to be vaccinated as part of the Sisonke study. The science on this matters. From what we've seen, as I understand the results of that study, your members have been protected against severe symptoms of COVID-19.
Yes, most of them, as we understand it from the Sisonke program, most of our members have been protected by this, but we did have some who developed severe symptoms actually, but very few compared to the rest of our members.
Dr. Mvuyisi Mzukwa, the Vice Chair at the SA Medical Association, I do appreciate the time. Thanks very much indeed.